In today's Social Security update, I have some breaking news for you. Medicare is targeted for massive cuts under Trump's bill. Yes, you heard that right. Medicare is also now being targeted, and Elon Musk and President Trump are in a public feud. What started as a good relationship between the two powerful men has now become an open disagreement online. And I'm going to give you an update of what that means for the work that Doge is doing to cut waste, fraud, and abuse, and what that means for Social Security benefits that have been targeted by Elon Musk. And the person that is replacing Elon Musk as the head of Doge, Russell Vought, is actually much more dangerous than we actually thought. He wants to cut Social Security. He wants to get seniors used to Social Security being cut so that in the future they will be able to privatize Social Security. Now, this is facts. We are not about politics. All we want to do is bring you the facts as we see it. And so I'm going to share the evidence of what I'm talking about and why Elon Musk is replacing himself with Russell Vought, and that he is actually worse because his ultimate goal is to privatize Social Security. But let's get started with the news about Medicare. So, Senate Republicans are considering ways to cut Medicare spending in order to help fund President Trump's major tax cut and spending package. You've heard about the big, beautiful bill. That is what I'm talking about. Now, Medicare is also on the table, and the focus, they claim, is to eliminate waste and fraud in Medicare. And they're going to do that through the Medicare Advantage program. So, what they're doing is that they want to crack down on insurance companies and their ability to do what they call app coding. And it's basically a way for Medicare Advantage companies to charge the government more money for providing services that may not necessarily be needed by seniors. And that way they're able to charge the government more money and make more money. So it's called app coding. So the Senate has come up with a legislation, a bipartisan legislation called the No App Code Act. And it's intended to help seniors by cutting Medicaid spending by $275 billion over 10 years. So they said they were not going to touch Medicare, but now we see that the bill is targeting Medicare spending, and they want to eliminate $275 billion of Medicare spending over the next 10 years. And it is a way to get money out of Medicare in order to fund President Trump's tax cut, the big, beautiful bill that he's been talking about. So Medicare is now part of the bill. Now, they are saying that they are not trying to cut benefits directly. Republican leaders, including President Trump, insist that any changes will not affect, the key phrase is, it will not affect current Medicare beneficiaries. It will instead target fraud, waste, and abuse. Now, the definition of fraud, waste, and abuse could be something that could be controversial, because I think they can use that as a pretext to cut more than they intended to cut. Now, the idea of touching Medicare to even address waste remains a very controversial idea in the divided Senate Republican caucus. Some fear a backlash from seniors and political opponents against that. So essentially, even though they are saying that they want to cut Medicare in order to avoid, reduce waste, fraud, and abuse, a lot of people are suspicious of those intentions, because every time the government tries to cut Social Security or cut Medicare to root out abuse, fraud, and waste, what they end up doing is actually cutting benefits for people who actually need it. So it was understood that Social Security and Medicare was not part of the cuts that are happening under the big, beautiful bill. But now we're seeing that Medicare is on the chopping block, and they are saying that they are not trying to touch benefits for seniors. They are only trying to cut waste, fraud, and abuse. I want to hear from you in the comments below. Do you believe Senate Republicans when they say that they are targeting Medicare in order to root out waste, fraud, and abuse, and that they are not going to touch benefits of current recipients? Do you believe them when they say that? Let me know your thoughts in the comment section below. Now, the The House of Representatives have passed their own bill, and their version did not touch Medicare, but the Senate is going to do that. But the House version did cut food stamps and it did cut Medicaid. So, what is going to happen next? Well, Senate Republicans are racing to pass their bill before July 4th. So, they have about a month to do it. And if the Medicare cuts are included, it will likely face a lot of backlash from seniors who were promised and told that their Medicare benefits were not going to be cut as part of this bill in order to fund President Trump's big tax cuts bill. So, the next thing I want to talk about is what is happening in the news. If you've been paying attention to the news, President Trump and Elon Musk, two people who have been almost best friends, are now in a public disagreement, in a public fight, in a public feud. And it all started with this big, beautiful bill. As I reported yesterday on my live, the bill, according to the Congressional Budget Office, is going to add to the deficit. And remember, Elon Musk is basically leading Doge in order to reduce the deficit. And so he's upset that now the Republicans have passed a bill that is going to add trillions and trillions of dollars to the deficit. So it basically is negating the hard work that he's doing with Doge to reduce waste, fraud, and abuse. And his goal was to cut $2 trillion from the budget. And now they're going to add several trillion dollars more to the debt. And that disagreement went out in the open, but President Trump is saying that Elon Musk is upset because EV credits has been cut or eliminated as part of the big, beautiful bill. And if you know, Elon Musk's main business is Tesla, which depends on government credits for people to be able to afford to buy the electric vehicles. And so now that the government is ending the EV credit program, Elon Musk is upset, and Trump is saying that that is why Elon is lashing out, and it has nothing to do with the bill. But Elon Musk is saying that the bill adds to the deficit and is pretty much making his work under Doge, all the work that he did under Doge, basically go to waste. Where does the truth lie? What do you believe? Who do you believe in this public battle and public fight between President Trump and Elon Musk? Let me know your comments below, because this started today and it has escalated with Elon Musk claiming on Twitter today that President Trump has not released the Epstein files because President Trump is in the Epstein files. I mean, this is getting dirty. And so I want to hear from you, because for the past year, these two were political friends and partners, and Elon Musk put a lot of money, $250 million, into President Trump's campaign. And Elon Musk tweeted today that if it wasn't for him, President Trump would not have won the election. He also tweeted that if it wasn't for him, the Democrats would have won the House, and the Senate, Republicans would have a slim Senate majority. Elon Musk is claiming that with his $250 billion that he put into President Trump's campaign, President Trump would be president today. Do you agree with me? Do you think that Trump would not have won the election if Elon Musk had not publicly used his money to try to support his campaign? What does this all mean for Social Security, food stamps, and Medicaid? Well, the problem is that Elon Musk was given free reign to cut programs, and he has proposed deep cuts to Medicaid, food stamps, and want to cut Social Security and Medicare because he thinks those programs are contributing massively to the debt. And so now that the two of them are in a public fight, what do you think is going to happen to the work of Doge? Is Trump going to continue to allow Doge to continue doing what it's doing, or is it now over for Elon Musk and Doge, because now that he's publicly criticizing the president for putting up a bill that is going to add tremendously to the deficit? I did not see this coming. I thought these guys were good buddies. I mean, Trump even publicly went to the White House and tried to pitch Elon Musk's electric vehicles. So he was on the White House lawn, pretty much being a pitchman for Elon Musk's vehicle. So I don't understand how we got here, where now the president of the United States is publicly fighting with Elon Musk and it's out in the public. So I want to know, because this has had consequences. The public SPAC has rattled investors. Tesla stock plunged 15% today and wiped out $100 billion in market value as about future of Elon Musk's companies under this hostile administration. And Elon Musk has also threatened to pull the SpaceX Dragon spacecraft, which is critical for NASA's mission. So what does that mean? He's saying that he's going to pull his Dragon spacecraft, and it means that he's going to deny the US ability to work or take astronauts to the International Space Station. And then they'll have to rely on Russia to do that. And then President Trump tweeted that it is because Elon Musk is bitter about the EV credits and that he's thinking about canceling all of Elon Musk's government contracts. So all of a sudden, things are escalating on Twitter between the two, and it's very, very interesting to watch. I want to know what you think about this battle that is happening between the president and Elon Musk. Now, back to Elon Musk. If you remember, Elon said that he's stepping away from the government and Doge is going to continue. Well, the person that is taking over Doge is even worse. And I'm going to talk to you about what that means. His name is Russell Vought, and he is the current Office of Management and Budget Director. But he was the architect of Project 2025, and he's been gunning at cutting Social Security and Medicare for a very long time. He wants, throughout his career, he's been pushing for cuts to Social Security, Medicare, and Medicaid. And now he wants to openly condition the public to be used to cuts so that eventually his plan is to privatize Social Security. One of Vought's long-term goal is to privatize Social Security, shifting away from a government guarantee to a private account managed by Wall Street. This will put retirement savings at risk, especially for those who cannot afford market downturns. And so if you want to really figure out what is going on with Social Security and what's going to happen with Doge, pay attention to this guy, because he is the one taking over Doge, and he is determined to begin slashing Social Security and Medicare, which has been his long-term public goal. And now he's in such a powerful position. Not only is he in charge of the Office of Budget and Management, which writes the federal budget, but he's also now in charge of Doge, and he's taking over from Elon Musk. And so expect more cuts. So what does this mean? Well, one, reduce Social Security benefits and higher retirement age. Two, increase risk of poverty among seniors. And three, privatize Social Security, making retirement savings less sustainable. Now, why should you care about all of this? Well, here's the thing. Vought's confirmation and influence mean that these ideas are not just theoretical, they are actively being pursued in Washington. And seniors should pay attention, because somebody like this in charge of such a powerful government agency is only means that we're going to see a lot of uncertainty around Social Security and Medicare. So let me know your thoughts about this new appointment of Russell Vought to Doge and what you think it means for your benefits. I want to hear from you in the comment section below. Now, there are a couple of things I want to share with you in the news. So I am going to share my screen and then walk you through things that are happening specifically regarding Social Security and Medicare. So let's start with Social Security. More Americans are filing for Social Security, are actually basically filing for Social Security at a record rate. And the question is, why is this happening? So I'm going to walk you through this article from CBS News. And what it says is that older Americans are filing for Social Security at a record rate this year, a surge that could reflect growing anxiety about the stability of the retirement system amid cutbacks under Trump administration. So record number of seniors are filing for Social Security. The question is, why? Well, let's continue to read. The number of people claiming Social Security has jumped 17% this year to 1.8 million this year through May, compared with the same period a year ago. according to the most recent data from the Social Security Administration. For the federal fiscal year, new filings are on track, up 15% from the prior year. The spike in early benefit claims comes as the Trump administration has slashed jobs and made other changes at the Social Security Administration, an agency already struggling. So here's the key thing: an agency already struggling to provide services to 70 million retirees, disabled people, and survivors of deceased workers who rely on the program. These developments are likely prompting the surge in new filings. So, why are a record number of people filing for Social Security? Well, it is primarily because people are afraid that their Social Security benefits may not be around, or it may not be around in the form that they have expected. And so, more seniors are now convinced that it is better to file for benefits now than to wait. And so that's why they are filing for Social Security in record numbers. Now, why should you care about this? Well, let's read some more so that you can understand what's happening. Although Mr. Trump has vowed not to touch Social Security, his administration has cut the agency staff to 50,000 workers, down from 57,000, and it's been going down since then. So here is somebody's thought about this. And I have attended several town halls around the country, and many people have asked if they should claim benefits early, given Trump and Elon Musk's interference in the system. This is from Max Richman, president of the National Committee to Preserve Social Security and Medicare, an advocacy group for two retirement programs. And he added that people are scared and they are not sure what to do. So essentially, record number of people are filing for Social Security because people are worried about the program. To be sure, Americans have long held concerns about the stability of Social Security system because the agency is paying out in benefits more than it is taking in through payroll taxes. So there's been worry about the Social Security program already. And then now, with the cuts that have happened to the Social Security staff and the rumors that are going around, especially with Russell Vought taking over Doge and promising to privatize Social Security, seniors are scared and worried. And so record number of seniors are not taking the chances and going ahead and filing Social Security. So that is the first news I wanted to talk to you about. I want to hear what you think about what is happening here, because is it what you do? Are you thinking of filing for Social Security early because you're worried that the program may not be around? I want to hear from you in the comment section below. Have you already filed for benefits? Are you happy with your decision to file, or are you going to wait? Are you concerned about Social Security being around, or do you think that it's best for you to just go ahead and get the benefits that you have earned before things get crazy and then the program changes? I want to hear from you in the comment section below. Now, the second topic I want to talk to you about is probably one that is going to cause a lot of seniors to get upset, because this was something that was promised and now it is not going to be fulfilled. So, Social Security recipients were hoping for a tax break. They are unlikely to get one, and here is why. Well, let me give you some context here. What is happening is that President Trump promised that he was going to cut Social Security taxes. Remember, no tax on Social Security. Well, that is necessarily what's going to happen. And let me explain through this article from CBS News. So, Republicans have backed legislation that was approved Thursday morning by House Republicans that includes two tax breaks promised by President Trump, but it does not include no taxes on Social Security. When President campaigned, he said seniors should not pay taxes on Social Security, and they won't. That is President Trump being quoted directly at an August 2024 rally in Harrisburg, Pennsylvania. Well, now they've passed a bill, and the bill is doing everything but that. So let's see what's happening. A provision to eliminate taxes on Social Security isn't included in President Trump's domestic policy bill that passed early Thursday following a dramatic all-night session. The bill will now go to the Senate, where Republicans have already voiced opposition. The reason for the Social Security exclusion boils down to a prohibition on making changes to retirement program through the so-called reconciliation process. So now we are back to square one, where seniors are not going to be able to get the relief that they thought they were going to get. Instead of eliminating taxes on Social Security benefits, the House bill includes something called a new tax break for seniors, an extra $4,000 deduction. But here's the trick: it is an enhanced deduction. So if you are not making enough money to pay Social Security taxes, then you are not going to be able to get this $4,000 tax deduction. And remember, 60% of seniors do not pay taxes on Social Security. And so this enhanced $4,000 credit, even though it looks good, it's not going to touch a lot of seniors. So let's read some more. Instead of eliminating taxes on Social Security benefits, the House bill includes a new tax break for senior citizens, an extra $4,000 deduction for filers who are 65 and older. It is called an enhanced deduction. It will be available to people who both itemize and those who take standard deduction. Now, but here is where the fine details reveals everything. The tax break has also an income threshold. If you earn 75,000 or less for married couples, you'll be able to claim. And then if you make more than 150,000 as a couple, you'll be able to claim it. But the thing is that a lot of seniors do not pay federal taxes on their Social Security benefits. So 60% of seniors are not going to see any change, because if you don't pay taxes on Social Security, this is not going to help you. You have to make enough money to be able to pay a substantial amount of taxes as a senior to be able to claim this credit on your taxes. And so a lot of seniors that were hoping for a tax break under this bill are going to be disappointed, because that is not what is included. The president is breaking his promise to eliminate taxes on Social Security. Instead, they're putting in this tax credit. And here's another thing: it's not going to last forever. It's only going to happen from 2025 to the end of President Trump's presidency. So again, this is not what he promised. And a lot of seniors are disappointed that this is what they are getting after supporting the president. Remember, more seniors voted for president than they voted um, for the Democratic candidate. So I want to hear from you. Are you disappointed that this 4,000 tax credit, they are not just writing a check and sending it into every senior? My opinion is that what they should have done was just give every senior a $4,000 stimulus or something and just send the check to seniors. But to make it a tax credit eliminates a lot of seniors. And right now, because of how much prices have gone up for everything, including prescription drugs, housing, rent, food, transportation, seniors are struggling. And so they need relief now, and they need money that goes into their pocket now. So to create a tax credit that seniors have to claim and wait on their tax returns to claim, versus sending relief in form of checks, stimulus checks, would have been the best option. And the reason Congress is not doing that is that they focus on taxes for the rich. So the big beautiful bill is supposed to make President Trump's 2017 tax cuts permanent. And those tax cuts skew primarily towards the rich. And so they are trying to find money in order to balance the budget to be able to extend those tax cuts. And so priorities for seniors, like sending a stimulus check to seniors, is not really on their radar, because they want to push this bill through and they are looking for money everywhere they can to be able to make this happen. So I want to hear from you. What do you think about this $4,000 tax credit? Do you think that they should have just sent seniors a check? A stimulus check would have been better than trying to make seniors wait until tax return time to figure out if they're going to get this credit. What do you think about that? and how seniors are going to lose benefits that they have relied upon. So let's talk about it. This is Fox News talking about House Republicans unveil new food stamps work requirement for Trump's big, beautiful bill. States will be required to pay more for the federal food stamps program. What does that mean for you? Why should you care about food stamps being cut? Well, House Republicans are moving to put strict work requirements on food stamps in a bid to cut government waste and fund taxpayer savings for President Trump's big, beautiful bill. Well, what you should know is that the portion released on Monday night will raise the upper limit for work requirements for the SNAP program from 54 to age 64. So if you're a senior and you're currently getting food stamps and you are not required to work because you're older than age 54, now they're pushing the work requirement to age 64. So it means that seniors up until retirement age have to continue to work in order to receive Social Security benefits. Now, this is going to throw a lot of seniors into a real bad situation because if you cannot work 80 hours a month, then you won't be able to keep your SNAP benefits because the work requirements, according to this Fox News article, you can see has been increased from 54, from age 54 to age 64. Here's that portion of the article that I want you to pay attention to. It says the portion released on Monday night would raise the upper limit for work requirements for the SNAP program from certain able-bodied adults from age 54 up to 64. Whereas the current rules exempt people with dependents under age 18, the new provision would include SNAP recipients with children above age 7 and make them work. So there's a lot of dramatic changes that are going to happen. But for seniors, the part that you should care about is that they're raising the age from 54 to 64. So by 10 years, it means that you have to work to continue to get food stamps benefit. And I want to know what you think because this is going to cause a lot of pain for a lot of seniors. Because if you're used to getting SNAP benefits without having to work as a senior, and now they're going to require you to get a job in order to keep your food stamps program, it is going to knock a lot of people off food stamps. And it's estimated that 10 million people, including 3 million seniors, are going to lose food stamps benefit as a result of this legislation. So I want to hear your thoughts in the comments section below. Now let's again talk about food stamps because I have more to talk about here. So let's get to this analysis by the Kaiser Family Foundation. And it says how the reconciliation bill would affect food stamps benefits. So let's look at this. The Congressional Budget Office has provided their input on what they think the bill is going to do and how seniors are going to lose benefits because of the big, beautiful bill. But here's what I want to show you. House Republicans are currently considering a reconciliation package that would make significant changes to Medicaid. And a lot of people are not aware how deep this goes. And so I want to show you the analysis that the Kaiser Family Foundation has done. It says an additional 8.6 million people nationwide could be uninsured if this reconciliation bill passes. Well, it has passed the House. And if you look at this map, it is telling you about the percentage of people that are going to lose benefits by state as a result of this bill. And if you see the darker colors, the darker the color, the more that state is going to lose people on Medicaid. When why should you as a senior care about Medicaid? Well, remember, there are 72 million people on Medicaid. It's the largest insurance program in the country, and it pays for 62% of all long-term care and nursing home stays in the United States. It also pays for 1 in 2 child births in the country. 1 in 2 children that are born in the United States are paid for by Medicaid. And a lot of people on disability get Medicaid assistance for their medical care. Plus, a lot of children are on Medicaid and seniors. There are some seniors that are both on Medicaid and Medicare. They're called dual eligibles. And so those people who are on Medicaid and Medicare, they their Medicare premiums are paid for by Medicaid. So you have seniors that when they hear Medicaid, they think that it does not affect them. But the thing is that there's a lot of seniors that depend on Medicaid to pay for their nursing home, to pay for their long-term care, but they also depend on Medicaid to also pay for their Medicare premiums. So when you see cuts like this, where you see a map where a lot of seniors are going to be losing benefits, it is a very, very scary situation. And this is happening right now. And here is another thing. It says an additional 13.7 million people nationwide could be uninsured if this bill passes. Well, the bill has passed the House. So what does that mean for you? Well, here's another map that shows that percentage point increase in uninsured population are Medicaid and ACA cuts changes proposed by the bill. So if you look at each state, the darker the color, the larger amount of people are going to be affected. So here, look at where the dark blue is. Florida is going to lose a lot in this scenario. States are going to lose a lot in this scenario. And you have Oregon, Washington, California, all are going to be impacted. Texas, New York, Illinois, and so forth and so on. Georgia. So it's going to impact Alabama, all these states. You can see the dark blue means that there's a lot of pain that is coming as a result of this bill. And they've done a great analysis pointing out state by state and providing each state analysis on what's going to happen. So when I click on a state, for instance, Florida, it says a combined, the policies are projected to increase the uninsured population by 1.8 million people in Florida alone, a 7% change. That is a lot. 1.8 million people are going to lose insurance in the state of Florida as a result of the big, beautiful bill. Now let's look at Texas. Texas combined, the policies are projected to increase the uninsured population by roughly 1.6 million people, a 5% change. So another big state that is going to lose a lot, New York, 810,000 people, a 4% change. California, 1.5 million people going to lose health insurance. Georgia, 610,000. Mississippi, 150,000. So forth and so on. But the point is that a lot of people are going to lose health insurance as a result of this bill. And I think a lot of people are not paying attention, but your health insurance is on the chopping block, including not just Medicaid, but remember also ACA policies. So the Affordable Care Act policies that saw Medicaid expansion is also going to be impacted by this analysis. So, the Congressional Budget Office estimate that Medicaid and Medicare changes, an estimated amount, 10 million people are going to lose benefit, and an estimated 1.4 million people are supposed to lose benefit coverage provided to immigrants. And I know that's a very controversial topic. That is politics, so I'm not going to get involved because that's not what this channel is about. My focus is how does this affect seniors? What are seniors going to experience if this bill passes? And that is my concern, and that is what I want to bring to you. So that is the Kaiser study. So let's now jump into another study that looks at how food stamps benefits are going to be cut and how that is going to affect seniors. So I'm going to pull that up and share that with you. So here we go. So this is from the Center on Budget and Policy Priorities. It's a think tank that does great work in analyzing changes that are happening in Congress and how that affects low-income households and seniors. So House Republicans' bill proposes deepest cut to SNAP in history, will take food stamps away from millions of low-income families. More than 2 million children live in households that would lose at least some SNAP benefits. SNAP could end in some states entirely. Guys, let's process that for a second. It says SNAP could end in some states entirely because of the changes that are happening. So the summary is that the House Republicans' reconciliation bill will cut nearly $300 billion from SNAP through 2034, according to the Congressional Budget Office. Now, the Congressional Budget Office is a nonpartisan office that whenever the House and the Senate draft bills, the Congressional Budget Office has to score the bill. They're a nonpartisan office that takes an independent look at how does that bill affect the debt, affect the deficit, how much money does it bring in, how much money does the government have to pay, and overall, who does it affect? Their job is to independently assess the effects of each bill. Why is that important? Because politicians will tell you what they think is happening, and most of the time, it's not the reality. So the Congressional Budget Office is there to be the referee that gives us the score of what the bill is going to do, regardless of what the politicians themselves are saying. So in this bill, it's saying that as a result of these cuts and other policies in the legislation, millions of people are going to lose benefits. The House plan will cut SNAP, the nation's most important and effective anti-hunger program, by 30%. They're going to cut 30%. As a share of the program, the cut will be about twice the size of the deep cuts to food stamps in 1996. You have to go all the way back to 1996 to see this level of cuts to SNAP benefits. And it will cut $230 billion out of the program. So how does this affect seniors? Well, the first thing is that they're going to increase the age limit, the work requirement, so that seniors will have to work more in order to get benefits. So a lot of seniors who are getting food stamps and were not required to work because of their age now will be forced to go back and work, because if you're 64 and under, you will be required to work to get SNAP. Now let's read some more. So the cuts will be to benefits, reducing the federal contribution. So that's the first thing they're doing, is that they are reducing federal contribution to the states, cutting federal funding for benefits in state by as much as 25%, slashing the federal government's share of administrative costs in half, and shifting those costs to already strained state budgets. And here is the critical part that I want you to listen to. When a state doesn't have sufficient revenues to backfill for the large federal cuts, it will have to shift funds from other vital services, or they will have to choose to cut SNAP benefits and restrict the number of people getting help, or they can opt out entirely of the SNAP program. This is the first time that this has been written into legislation, where a state can then decide that the financial burden is too much and that they don't want to participate in the SNAP program anymore. So something that was funded 100% by the federal government, that has been one of the biggest anti-poverty programs forever. Now, not only are they cutting it by 30%, but if a state cannot afford to fill in the cuts that the federal government is making, then the state can decide that they don't want to participate in the food stamps program entirely. And states have done that. Remember, there's a program called the Summer Nutrition Program for Kids, the Summer EBT program, and it's the same thing. States can opt out. Even though it's government money, the state can decide that they don't want a part of it. And so this is how they're setting up food stamps now, where states can now opt out and walk away from it, which is going to be devastating. The plan walks away from a 50-year bipartisan commitment to ensure that low-income adults, children, and seniors get help they need regardless of where they live. The consequences of ending SNAP will be severe. Including children hunger, would soar despite the well-documented detrimental impact of even short periods of food insecurity on children's health and cognitive development. Every $1 invested in SNAP for children returns $62 over the long term. That is the value of SNAP right now. The next thing they're doing about food stamps is this. They're going to expand SNAP's harsh, ineffective, and red tape work requirements, including older adults. Here's where I want you to pay attention. Including adults and parents with children under 7, putting basic nutrition for millions of children at risk. The provision would take food assistance away from 3.2 million adults in a typical month, including 1 million older adults between age 55 and 64. So 1 million seniors between age 55 and 64 are going to lose benefit as a result of this bill. And then it gets worse. They're ending food assistance for 100 to 200,000, 50,000 people that have lawful immigration status who are getting food stamps and were paying taxes and are lawful residents. Now, that could be debated, and I'm not going to get into the politics of it. So you tell me what you think about that in the comments. And then they are cutting food benefits for people with low income by permanently freezing the thrifty food plan outside of inflation adjustment. This is huge. And let me explain what this means. The thrifty plan is how food stamp increases are decided. And what it does is that it helps increase your food stamps benefit. It's like a food stamps raise every year. So by limiting the food stamps raise, it means that you're not going to be able to get the full benefit of your food stamps money, because every year your food stamps dollars is going to buy less and less and less. And that is their way of a backdoor way of cutting benefits by freezing food stamps increases. So what does this mean for you? Well, let's look at the 4 ways that they're taking food stamps away. They're slashing federal funding for states, risking deep cuts, and even causing states the possibility of getting food stamps business together. They're taking food stamps from millions of people, including families with school-age children and seniors, and they're bringing in harsh work requirements that cause a lot of seniors to continue to work to get benefits. So the cuts to SNAP by 30% through 2034, millions of people, including more than 2 million children, will lose some or all of their food assistance they need to afford groceries. So a lot of this is devastating, and I want to hear what you think. Do you believe that this is the right thing for Congress should be doing, to be cutting food benefits at a time when we have record inflation, price increases that have not gone down, and a lot of people are depending on these benefits in order to survive? So let me know your thoughts in the comment section. And finally, let's talk about Medicare. If you are a senior and you are turning 65 and you don't currently have a Medicare plan, or you're in a Medicare plan and you're not sure you are in the best plan, our partner, the number you see on the screen, Chapter Benefit. Chapter Medicare is there to help you, advocate for you. So call the number on the screen, and what they will do is that they will show you in your local area all the Medicare options that are available to you. Now, the Trump administration recently sued a lot of Medicare advisory companies for taking advantage of seniors. Chapter Medicare is there to do the opposite. Their main mission is to help you get the best Medicare plan based on your needs, your budget, the doctor networks that you want to be in, and they're there to advocate for you. They don't even pay their agents to push anybody's plan. They want to get you the best Medicare plan that's available. So if you're in a Medicare plan and you're not sure you're in the best plan, or you're just curious, are you getting the best plan for your needs? Call Chapter. Call the number on the screen, 204-147, or go description to this video. Link, quick form you can fill out. These guys have A+ ratings with the Better Business Bureau, tons of 5-star reviews online. These guys are the real deal because it came from a personal experience of one of the co-founders that watched his parents go through the frustration of trying to get on Medicare and realize what a terrible process this was. And that was one of the reasons why this company started. And so Chapter is our partner. I have been creating content for seniors for 15 years. This is the first time I'm recommending a Medicare partner because these guys are the real deal. So if you're just curious, it's no cost to you. Call Chapter or fill out the form. And I promise you, all the people that we've sent to Chapter have come back praising their professionalism, how helpful they've been, and they'll be able to save on average $1,100 a year for Medicare beneficiaries. So that is what I want to bring you today in terms of news updates that is going to impact seniors. Join me tomorrow for another edition of Senior News Update. I am Kwame Kwade. Thank you for spending this Thursday evening with me, and I'll see you tomorrow.